Hi, my name is Eliana Valle. My topic is nasal deformity in granulomatosis by Polyangitis. Definition: the GPA is a rare disease of blood vessels in which they become inflamed. Small protuberance known as granulomas could also be formed when the cells darken but vessels die. This can cause a decrease in blood flow to its organs, more common to your respiratory tract, lungs, and kidney.
Granulomatosis with polyangitis, also known as Wegener's syndrome. And Wegener's syndrome is the most common ANCA-associated vasculitis, and more than 95% of patients are ANCA positive against proteinase 3. It is a small vessel vasculitis characterized by inflammation of the small blood vessels with infiltration of immune cells forming granulomas. The granulomas are formed by T cells and other immune cells. Granulomatous inflammation occurs in the blood vessels of the upper respiratory tract, lower respiratory tract, and kidneys in granulomatosis with polyangitis. And this is the Wegener's triad: upper respiratory tract, lower respiratory tract, and renal tract involvement. Granulomatosis with polyangitis is the most prevalent of the ANCA-associated vasculitis, with a mean age of onset of 40, but really can occur at any age. It occurs in females and males equally. Histopathological findings include granuloma formation, as mentioned, but also palsy immune necrotizing vasculitis of the small arteries and also the small veins. Clinical features include the nonspecific arthralgia, fevers, cough, weight loss. Then you have granulomatosis with polyangitis triad involving the upper and lower respiratory tracts and kidneys. Upper respiratory tract findings are often severe and include paranasal sinus pain and drainage, and purulent or bloody nasal discharge. Nasal septal perforation may follow, leading to saddle nose deformity, a buzzword to remember.
Application in nursing. In nursing, the symptoms must be monitored are uneven in patients with airways disease or diffuse pulmonary hemorrhage and include fever, dizziness, and hemoptysis. Patients with this pathology need of that is framed according to A.M. Gordon, orientation, and Nisus Nandan, Nick, and Nock taxonomy. The patient critical situation requires that the crippling be evacuated continually to be modified action regarding market targets. They continue the pros and cons. Pros and cons. Pros. Granulomatosis with polyangitis is served both treatable to prevent complications. It is essential to make the diagnosis and treatment as soon as possible. Cons. The cause of this disease is unknown. In general, the GPA affects nasal bridge, lungs, and kidneys. It can lead to renal insufficiency if it's not treated. The reappearance of the disease is frequent. It should apply in Ecuador. The whith is a rare disease that predominate in the middle shade of light preferable effects makes. In Ecuador, an incidence of 8.5 per 1 million of inhabitants per year and prevalence of 3 per 1,000 people have been reported renal continence is frequent, reaching up to 8% of patients. It manifests itself as hematuria, spleninuria, proteinuria, with or without renal insufficiency. Let's continue with the video.
I'm Jennifer Gordon, and I'm a native Philadelphian. I was diagnosed with EGPA 3.5 years ago. I've never really been sick before. I did have allergies as a kid, and in my 30s and 40s these started to get worse and became year-round. And then I started to develop asthma as an adult, but otherwise was pretty healthy. And then things started to get strange. I had this whole constellation of symptoms. I had sinus problems, the lung problems, the asthma, the eosinophilia, the neuropathy, the skin problems. So all of these were pointing toward possibly EGPA. Yeah, so when I'm having a flare and my vasculitis is active, it's kind of like slogging through quicksand. Everything is like an assault. Light, heat, wind, whatever, coming at you. And you're just trying to push through everything day after day. One of the biggest impacts on me has been meeting other patients with EGPA and vasculitis. Being able to talk to or communicate with other people that have my disease is really, really important. It's been life-changing for me. Living with EGPA is living with uncertainty every day. I don't know what's going to happen tomorrow, but I'm going to be ready for it.
Conclusion. Granulomatosis with polyangitis GPA is a systemic vasculitis of small glass, which most frequently affects the respiratory tract and kidney. Its diagnostic criteria are based on the clinic. It is a potentially serious disease, however, hot and early diagnosis. Granulomatosis with polyangitis can be treated effectively. Thank you very much.